Hi, I'm Dr. Jason Young, and welcome back for another segment of the interview that I did with Stacie Dodson. Last time we covered the questions, I eat healthy, do I still need supplements? And why doesn't my doctor recommend supplements? And we nailed the answers to both of those questions. We got them both right. So this next video segment covers just one question. Aren't supplements dangerous and unregulated? So hopefully you enjoy it. Feel free to comment, share this video, and we'll see you afterwards. And if you want a link to the previous video, I'll include it in the comments on this one. So what about this next question? And I'm sure you get this sometimes. Aren't supplements dangerous and unregulated?
That's a really good question, and yes and no. They are regulated by two agencies, the FDC and the FTC, much like food is. They're not regulated as pharmaceuticals, totally different category. So it's kind of like buyer beware, unfortunately, in a lot of cases. So generally speaking, I like to recommend people to choose a company that has a reputation to lose. What I mean by that, they've been around for a long time. They've been established as a company that does provide quality ingredients. Also that they have actual science based, I know, right? So any claims that any company makes, you need to do your due diligence and actually look to see that they have independent third-party research. Not their own research, but someone else that puts it in a peer-reviewed journal. People are trying to basically debunk that claim because that's going to be your best source of good information.
Yeah, and I agree. So I have an article that I like to share with patients who come in, because I'll admit, so probably about 3-4 years ago, people would come in and they would, and I'd check them out, we'd talk, and I said, oh, you need some vitamin X, whatever that is. And they'd be like, well, where do I get that? And I'd say, well, you could get it just about anywhere. You could go to Fred Meyer, there's a vitamin store, you could order it. And then I read this article, and in New York, they went through and they pulled supplements off the shelf in some like places where you would expect maybe the supplements to be kind of lower quality, like Walmart or like Target, right? But then they also pulled from some places that you would think that you could trust whenever it comes to supplements. So, like I think the one was CVS and GNC, right? And so they tested these products and they found that in some cases, like there was zero of what they were claiming was in the bottle. So you could buy a bottle of magnesium and there's not any magnesium in it, or a bottle of calcium and all you're getting is wheat filler. And that was another issue too, is that some of these things, they weren't saying on the bottle that they contain wheat, and for some people wheat is really dangerous. If you've got celiac disease, that's actually going to hurt you, it's not going to help you. And I think one of the worst things about that is that for some people they miss their opportunity. So like if I find somebody who, like let's say they've got migraine headaches and constipation and, they're getting Charlie horses at night and things like that. And I'm thinking, okay, this person, they really need some magnesium, right? Because that's a pretty common presentation for people who are low on magnesium. And I say, hey, take some magnesium. And I just send them out to get any sort of magnesium, and they buy something that says magnesium but isn't magnesium, and they take it. They check magnesium off their list. So they'll still have all those symptoms, but they've checked magnesium off their list because they've tried it and it hasn't helped. And so that's I think one of the biggest dangers is you get false information back whenever you're using somebody who isn't really vetted.
Right.
And so what I did when I discovered this information was I got really kind of stringent and strict about which brands I use. And so there were some things that I even carried here that I was like, okay, I got to throw all that out because I have no idea what kind of vetting process they go through. And so now I don't recommend something unless I feel really, 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 really comfortable with the fact that they're testing their batches, they're making their formulations based on science and things like that. And you know what happened? Like I started getting better results with patients, and it increased compliance because if people see things work, they keep doing it. And so yeah, it's the world of supplements is kind of a seedy, like sleazy world. If you see something on TV and you're up at 3 in the morning because you have a health problem that won't let you sleep, and you see this thing come on, and it's like, we'll make this bigger, or this stronger, or this faster. Don't buy that. Yeah, you have no way of really kind of vetting something like that.
Generally, if it's sounds too good to be true, and they claim that they're treating something, generally probably good to stay away from that.
Unless I'm saying,
yes.
unless
Well, that
I'm
brings up another
recommending
point.
it.
If someone's confused about what to take, because they might say, well, I need vitamin D, but they don't realize that there's various forms of vitamin D, or they need to take iron, but there's different kinds of iron.
Right.
Like, they should see someone who knows about nutrition or wellness to find out what kind of vitamin D they should be taking, what kind of iron they should be taking, so they're not wasting their money.
And that's a really good point too. And a lot of times, what's really interesting is we don't even get the best form of everything in supplements. And so when they research supplements, just because there's no, like, I'm going to say, I told you to push me out of the chair if I say big pharma, but here it is. Don't do it, Stacie. There's no big pharma money behind it. A lot of times when they test supplements, like, for example, B12, okay, it's cobalamin. So they do the research on a form of cobalamin called cyanocobalamin. So I'm getting nerdy here. Cyanocobalamin is like the cheapest form of B12 that you can get. Maybe not the best form, because that cyano part is cyanide. So when the cobalamin, which is the B12, splits off, you're left with some cyanide in your system. And, cyanide is a poison. So how significant is that in terms of your health? I don't know. But, there's other forms that probably, and actually in the case of B12, definitely are more helpful, like methylcobalamin. So your body needs lots of methyl groups, little chemicals floating around. And so taking something like that is probably better for you. But what do they put in most B12 supplements? Cyanocobalamin. For two reasons. Number one, that's what the research is done on. Why is the research done on it? Because it's cheaper.
Right.
And then number two, it's cheaper. And so they can make a cheaper supplement. And so it's, but that's not something that you'd expect people to just know.
Exactly.
Right? And so that's, like you said, that's when it's helpful to be able to get some help from somebody who knows what they're doing. And you don't have to read a bunch of articles, because you have somebody like you or somebody like me who's read those articles for them.
Exactly.
And at the cost of spending time with their family and making friends and things like that. So yeah, people don't want to sacrifice their friends for the right form of B12. So. Hopefully you enjoyed that segment of the video. Again, comment, feel free to share. Hopefully you appreciated this video. Tune in again for our next segment. Like I said, I'll be posting these over the next few days. If you want more information about my business or how to get in touch with me, you can go to yourbodyofhealth.com. Otherwise, if you'd like to get in touch with Stacie, you can search for her on Facebook. Just search for Stacie Dodson. That's Stacie. Dodson is Dodson. And feel free to like her page, follow her. She's got lots of great information. Again, thanks for watching, and we'll see you in the next segment.